raise funds. We've got 31 countywide road millages. We've got 580 township millages. And then we've got some millages for customized needs. I look at the countywide millage, and you got to remember, when you do a countywide millage, you have to share that money along with the municipalities and whatever jurisdiction they're in, that they're included. So a countywide millage doesn't mean that money just goes to the roads. You have to share that with the municipalities in your jurisdiction. Federal revenue. Right now, we average about 10%, as I showed in that pie chart. We get about 10% of our money for each county is federal aid. Federal aid is generally in the statute, in the Michigan Transportation Fund. It says that we, as local units of government, all 613 or 616 of us, get between 23 and 20%, 27% of the federal aid. That's great. But the number of road agencies that are involved in that division of that money really waters it down rather quickly. And I'll tell you a little bit more. Right now, the department has been averaging about 25% to the local agencies, and that includes the urban areas. There's alternative use. We have been working really, really hard to figure out how do we get more money, state money, into the hands of the road agencies and avoid all this federal red tape. Federal red tape is it's a minefield. When you've got a county that has maybe 5 administrative people in their office, they're doing projects, and then you get a federal aid project. That unique federal aid project requires a lot more handling and a lot more attention to detail. I see Brian Bukowski here. He can quantify that fact that it is not an easy game. Yeah, it's 80% of your project money, but all the red tape and the hassle that goes with it, I don't know if it's really worth it. So we came up with the ability for locals to sell their federal aid back and forth amongst themselves. And right now, we've got probably all of your urban counties buy rural federal aid. That takes it out of the hands of the rural counties with the small staff, and they give them 80 cents on a dollar, 85 cents on a dollar, whatever they negotiate. It's negotiable, let's put it that way. So that's been working really well. Through the process, we also came up with an idea. What if, actually we didn't come up with it, we had a presenter at the County Road Association annual conference who showed us how they could sell their money back to the state agency, which is totally fit, they're qualified and able to handle federal aid projects and federal aid money. They can do it a lot better than we can. So we kicked it around and we said, well, how about if we try to get MDOT to buy our federal aid? Great idea. Well, we finally got the legislation introduced. We're on the 3rd year of that program. It originally started with 25 million. First year, 35 million. The second year, 45 million. The 3rd year, and from then on, the 45 million can be sold back to the department. And if you're willing to sell, they must buy. That's the only kicker. But you have to do the project that you're selling the dollars for. If you got dollars for a specific project must be done within 3 years. That's a nifty option that's going around really well. And MDOT has to pay 90 cents on the dollar. There's a benefit to them getting that money. They can use it better. And they have to, any federal aid projects, they have to approve. They have to go through the review of the design, the planning, the bidding, the management, all the financial headaches. They bear that responsibility. So for them to not have to get that information from us, they already have it in-house or in their regional office. It's $1 savings for them at the end of the day. So that's why we felt we should have asked for $1, or we did ask for $1, but we negotiated down to 90 cents on the dollar. So we're excited about that program. All right, let's talk about Total Road Bridge Fund Federal Aid. The IIJA, these numbers that I'm throwing at you are pre-IIJA, the federal road and bridge authorization statute that was enacted a couple of years ago. So in 2021, we were getting about 1.1 billion. Let me remind you too, that we don't get a check for 1.1 billion. It's a reimbursement program. We, the state and the locals, have to spend the money, and then the department submits those bills to the feds, and then they reimburse us. So we're always putting money out, or the department is putting money out firsthand, and then they're getting reimbursed. As long as we fulfill all the paperwork that's required, we get reimbursed.
Do you meet the appropriated amount every year?
Yes, there is a informal formula. I hate saying it like that, but that's the way it goes. It just depends on the silos, how much money is going into each federal aid program silo. We get a certain amount of that money. It's not always 25%, it's not 15%. It varies from time to time, just depending on the amount, the dollar amount that's actually being allocated to the state. Right now, they allocate $120 million to 13 MPOs. Those are your metropolitan planning organizations. The remaining dollars will go to 25% go to the rural task force. Those are RTFs. Those are multi-county regional planning organizations out in rural Michigan. Some of them have 5 counties, some of them have 7. There may be one as low as 4. I'm not 100% sure, but they get about $15 million to spread amongst the remaining counties. And that's a small number compared to the total dollar amount that's actually given to the locals. But that's what we get, and that's what we live with. That's how we're playing the game right now. There's also 56 small urban areas. There's off-system bridges, which off-system bridges are not federal aid bridges,
Correct.
not federal aid eligible bridges.
Right.
And then we were talking about CMAQ. That's congestion mitigation and air quality, if I'm not mistaken. That's some goes to the urban areas for controlling pollution.
Ed, you talked about when you spend that 1.4 billion and then they refund you. Does that work out pretty good? Because sometimes it don't.
Well, it's a real tricky little situation here is because we have an engineer's estimate when we apply for the money. When we go to bid for the project may come in underbid or overbid, and the department's got to adjust the federal aid, our local federal aid portion back and forth. And then the department is also taking money from the bottom up because they have to close out projects, federal aid projects. So they're taking little chunks of it from the bottom too. So it does work out, but there are some counties who really, and I thought this too, that do a project and they say, ooh, I saved 200,000. I want to use that for something else. Yeah. Well, that's not how the program works. The program works on what was the bid. Okay. That's what we're going to allow you to spend. If you have overs and extras, we'll cover that too. But again, that's draining from that federal obligation balance too. So there's three categories. You got the original project, you got overs and extras, and then you got the department sucking it up from the bottom.
Very good, thank you.
Yeah, can I add to that? So, MDOT's fiscal year is October 1 through September 30th. If you don't get your project in early in the fiscal year, there's a chance that the federal aid is used up because if some of the bids come in way over, MDOT's still going to fund that, and if you're a late bidder, there's no more federal monies left, and yet you might lose your funds for the year.
Yeah. Oh, excuse me. No pun intended here, but the PowerPoint did not talk about charges for services. I'm pretty sure that's maintenance. 63 counties do routine maintenance for the Department of Transportation. We get paid for that service, so that's a revenue. There could be a revenue source in there. That's what that dollar amount is. And then we've got the other. Others include licensing, permit fees, earned interest, land and buildings sales. There's also installments for purchases and other leases. So there's a little multitude of other areas where we could generate small amounts of revenue.